Question 1. A 10-year-old child with hemophilia A has slipped on the ice and bumped the knee. The nurse would prepare to administer which prescription? 1. Injection of factor X. 2. Intravenous infusion of iron. 3. Intravenous infusion of factor VIII. 4. Intramuscular injection of iron using the Z-track method. Explanation. Question 1. Rationale. Hemophilia refers to a group of bleeding disorders resulting from a deficiency of specific coagulation proteins. The primary treatment is replacement of the missing clotting factor. Additional medications, such as agents to relieve pain, may be prescribed, depending on the source of bleeding from the disorder. A child with hemophilia A is at risk for joint bleeding after a fall. Factor VIII would be prescribed intravenously to replace the missing clotting factor and minimize the bleeding. Factor X and iron are not used to treat children with hemophilia A. Test-taking strategy. Focus on the child's diagnosis. Eliminate options 2 and 4 because they are comparable or alike. Recalling that a child with hemophilia A is missing clotting factor VIII will direct you to the correct option from those remaining. Question 2. The nurse is preparing to instruct the parents of a child with iron deficiency anemia regarding the administration of a liquid oral iron supplement. Which instruction would the nurse give the parents? 1. Administer the iron at mealtimes. 2. Administer the iron through a straw. 3. Mix the iron with cereal to administer. 4. Add the iron to formula for easy administration. Explanation. Question 2. Rationale. In iron deficiency anemia, iron stores are depleted, resulting in a decreased supply of iron for the manufacture of hemoglobin in red blood cells. An oral iron supplement needs to be administered through a straw or medicine dropper placed at the back of the mouth, because the iron stains the teeth. The parents would be instructed to brush or wipe the child's teeth, or have the child brush the teeth after administration. Iron is administered between meals because absorption is decreased if there is food in the stomach. Iron requires an acid environment to facilitate its absorption in the duodenum. Iron is not added to formula or mixed with cereal or other food items. Test-taking strategy. Eliminate options 3 and 4 first because they are comparable or alike and because medication would not be added to formula and food. Next, note the word liquid in a question. This would assist you in recalling that iron in liquid form stains teeth. Question 3. Laboratory studies are performed for a child suspected to have iron deficiency anemia. The nurse reviews the laboratory results, knowing that which result indicates this type of anemia. 1. Elevated hemoglobin level. 2. Decreased respiratory count. 3. Elevated red blood cell count. 4. Red blood cells that are microcytic and hypochromic. Explanation. Question 3. Rationale. In iron deficiency anemia, iron stores are depleted, resulting in a decreased supply of iron for the manufacture of hemoglobin in red blood cells. The results of a complete blood cell count in children with iron deficiency anemia show decreased hemoglobin levels and microcytic and hypochromic red blood cells. The red blood cell count is decreased. The respiratory count is usually normal or slightly elevated. Test-taking strategy. Focus on the subject, laboratory findings. Eliminate options 1 and 3 first, knowing that the hemoglobin and red blood cell counts would be decreased. From the remaining options, select the correct option over option 2 because of the relationship between anemia and red blood cells. Question 4. The nurse is reviewing a pediatrician's prescriptions for a child with sickle cell anemia who was admitted to the hospital for the treatment of vaso-occlusive crisis. Which prescriptions documented in the child's record would the nurse question? Select all that apply. 1. Restrict fluid intake. 2. Position for comfort. 3. Avoid strain on painful joints. 4. Apply nasal oxygen at 2 L/minute. 5. Provide a high-calorie, high-protein diet. 6. Give meperidine, 25 mg intravenously, every 4 hours for pain. Explanation. Question 4. Rational. Sickle cell anemia is a hemoglobinopathy in which abnormal hemoglobin S causes red blood cells to sickle and obstruct blood flow under low oxygen conditions. Treatment requires oral and intravenous fluids to prevent sickling. Meperidine is not recommended for children with this disease because its metabolite, normeperidine, can accumulate and cause seizures. Comfort measures, oxygen, and a high-calorie, high-protein diet are also important in managing the disease. Test-taking strategy. Focus on prescriptions that conflict with sickle cell pathophysiology. Fluid restriction and meperidine use should be questioned because fluids prevent sickling, and meperidine poses seizure risks. Question 5. The nurse is conducting staff in-service training on von Willebrand's disease. Which would the nurse include as characteristics of von Willebrand's disease? Select all that apply. 1. Easy bruising occurs. 2. Gum bleeding occurs. 3. It is a hereditary bleeding disorder. 4. Treatment and care are similar to that for hemophilia. 5. It is characterized by extremely high creatinine levels. 6. The disorder causes platelets to adhere to damaged endothelium. Explanation. Question 5. Rationale. Von Willebrand's disease is a hereditary bleeding disorder characterized by a deficiency of or a defect in a protein termed von Willebrand factor. The disorder causes platelets to adhere to damaged endothelium. It is characterized by an increased tendency to bleed from mucous membranes. Assessment findings include epistaxis, gum bleeding, easy bruising, and excessive menstrual bleeding. Treatment and care are similar to measures implemented for hemophilia, including administration of clotting factors. An elevated creatinine level is not associated with this disorder. Test-taking strategy. Focus on the subject, assessment findings, and on the child's diagnosis. Recalling that this disorder is characterized by an increased tendency to bleed from mucous membranes will direct you to the correct options. Follow our lessons and boost your chances of passing. Now, let's dive into the next video of our session.